Actually, I really like this section. So what I'm going to do now, and again, this is one of those little sections that you could do as an independent breakout. In other words, you could be doing some other kind of session in therapeutic day, and you could actually take the client into this position, and you could incorporate this particular sequencing that we're going to do, which is the posterior shoulders, neck, head, crown of the head, and facial. And you could incorporate that into just about any kind of a session. For example, let's say you were just doing a lymphatic focus. So you were doing a session where maybe you did puja and warm up, and then did lots of rocking and lots of shaking and lots of jostling, okay, perhaps with one of those dosha emphasis that we talked about in level 4. You could do, simple rotations, prone, side, whatever, and then you could just literally come up to the head and you could do this as a finishing sequence. All right. Let's say you were doing the seated position where you could do the puja warm up, do this, have the client sit up in seated position, and then do a seated treatment. Or you could do a seated treatment first, and you could have them lay down, and you could do this as a finishing set on the seated position, followed by warm-up, puja, and finish, and then let them kind of chill and relax in savasana for a few minutes at the end. This is a really good one to, when you finish, let them be in savasana for 3 minutes or 5 minutes if you have time, right? If you have someone who has headache, okay, this particular point sequence is very good as an addition to a headache treatment. It's not sufficient by itself as just a headache treatment, but it's really good to incorporate into a headache treatment, all right? And as you get more advanced, and let's say as we're moving into CTP3, okay, one of the things that you're going to be doing in CTP3 is we're going to be having conversations about more targeted or specific treatments, like the headache treatment, the low back pain treatment, the hip pain treatment, the abdominal pain treatment, as far as taking what you already know and repackaging it in such a way that you have sort of a targeted treatment. And where do those treatments fit in? Well, they fit in, they're supplemental to the therapeutic day. So they're supplemental in addition to everything else. And or when you don't have time for anything else, like if you're traveling or you're off somewhere and someone's having an issue and you want to just really be able to help them, but there's no way, you don't have time for long treatments, you don't have time to do a whole 7-day therapeutic day program, so you're just going to do a headache treatment, okay? Now, will that cure the headache? I don't know, because I don't believe there's anything such as a simple headache, okay? Philosophically, I don't believe there's any such thing, okay? But can it be helpful as far as just really de-stressing and maybe helping and reducing the distress that the person is in? Oh, absolutely. Yeah, see, so even short treatments can be very, very helpful for that. You guys, after you've been around me for a while, you'll notice that many times I do sort of what I call Band-Aid treatments, which is little specific corrections with just a few little motions and about 10 minutes of emphasis, and then kind of cut you loose, okay? And you'll notice that sometimes even those little treatments, really, they're quite powerful, and you get a lot of benefit from them. So yes, short treatments have merit, they do. And this one is another one you could do by itself, but we do this in 2 different seated positions. I'll show you first just in the soft lotus, but here, sit up a little bit, and I'm going to scoot under, right? Let your head come back into my lap, all right? And so I've got her head situated in my lap, and I am not going to be able to look at my hands while I'm doing this. So you can't be all attached to seeing what you're doing and do this kind of treatment. I start with on top of the shoulders, as tight as I can get to the neck. Again, again, without actually choking my client, okay? I try to keep pressure off of this area of the neck, the center part where the larynx is, but I'm gonna just push straight, and I'm gonna work 5 points. 1, 2. Now, of course, I don't have a lot of mechanical leverage here, so this is more about bringing energy, attention, consciousness, and breath to the points than it is about pressure. I'm going to work these 5 points 3 times, and they're about 1.5 times the width of your thumb apart. So they're 5 marmas or 5 wind gates right on top of the shoulders here. Now, as soon as I do that, I'm going to change. I'm going to rock the head up just a little bit so I can get through this tangled morass of hair to the base of the neck. And we've practiced this hooking thumb, these hooking fingers. We've also practiced in the Royal method. We did this push-up where we actually worked a line with finger pressure, substituting finger pressure for the thumb. It's the same technique here, okay? Only now my leg is the floor. So I'm gonna hook under as low as I can get beside the neck, okay? And I'm just gonna hook up, and I'm gonna work 5 points all the way up on the back, as tight to the spine as I can possibly get. And if I have to turn that head over just a little bit, I'll do that, but actually I find it works better when I have the weight of the head counterpressing on top of my fingers. See, now gravity and position is offsetting position and leverage, okay? All right, so I'm just gonna work up to the base of the cranium as tight as I can get. One finger, one side at a time. It's not bilateral. It's one side at a time. I'm going to go up, down, and up. Just working. Of course, it's impossible to see what my hands are doing if I'm in the right place. Okay? But this is what I'm doing. This motion right here. Okay? We have all kinds of energy lines that are on these. For example, just on the shoulders, we have small intestine, we have gallbladder, and we have urinary bladder as far as meridians. On the neck, we've also got urinary bladder, and we've also got the prananadis, Sin Itta and Sin Pingala and Sin Kalatari, that we're actually able to bring energy to in this position. So I'm doing the same thing now on the opposite side. Which side would I start with? Well, left side for woman, right side for man, except when I'm in class, and you guys know our class rule is, in class, we alternate, we start from both sides, because it's not a treatment, we're doing repetition. That's the only reason we do that. All right, now, that has led me to the base of the cranium. Anatomically, that's the atlas occiput. In other words, actually where the spine attaches to the cranium, okay? And what I'm gonna do now is I've got those cranial base points. We've worked those previously, okay? I'm gonna push down with my hands into my lap and up with my fingers into those points. And I'm just gonna hang out here for about 10 or 15 seconds with this little bit of leverage. And what it's doing is, it's actually an occipital release on gallbladder 20 bilateral, so it's gallbladder 20 on both sides, okay? And gallbladder 20 is an acupuncture point that we call the cranial base points, which are always indicated for migraine headaches and for severe headaches. But even aside from that, these points are so important that they're good for just general de-stress. So just reducing stress and reducing the activity of the sympathetic nervous system. We're doing that quite well now. So I hold this for about 15. The reason I say hold it for about 15 seconds is if my client is normal and healthy, somewhere between 10 and 12 seconds, give or take, they'll actually start to release. And the head will actually start to rock over my fingertips into my lap. I can feel it. When I feel that release, that's when I know I'm done, okay? So now I'm gonna rotate to one side, and I'm supporting the head in my lap with the hand that's on the bottom, just supporting, right? And still using this kind of hooking finger technique, I'm going to start from the very center of the back of the cranium, and I'm going to push in and hook back toward me. And I'm going to work 5 points from the center of the back of the head to over the ear. Okay, so here I go. I'm going to go 1. And I have to think of a crescent. So we sometimes call these points the cranial crescent points because they go from the center right here in the back of your head up over the ear. So I'm not actually following the cranium all the way around the corner. There's a reason for that too. Whenever you're working points around the base of the cranium, you never come up onto this hard point behind the ear where the cranium kind of squares off. If you look on the skeleton I have, or on that anatomical model over here, there's actually something missing. There's actually a body part that's not on the chart. And there's actually a body part, a bone, that's not on the skeleton. The reason why, it always breaks off. Okay? Because technically there's this little bone that hangs off the end, or comes off the end right here of this corner of the cranium right there, and we call that the mandibular stylus. All right? And it's about that long, and it looks like a little horn that comes to a point. All right? Looks like a little horn that comes to a point. Okay? The omohyoid muscle, which actually is what controls your ability to swallow, attaches to the bottom of the mandibular stylus. All right. Now, it's such a little bone that after you die, okay, if you're dissected and someone sets your cranium down, they'll break off. And so that's why you never see them. You don't see them, they don't come with cranial kits. Usually you buy the cranium and you don't see these horns hanging off because you can't set the cranium flat when the stylus is still attached. Okay, they always break off. Well, heads up, they always break off. So do I want to put a lot of pressure on them? No. The answer is no. Okay? Because if I crack that bone, okay, my client loses the ability to swallow, or has an impediment in swallowing. And boy, if you think you've ever been in distress, try and have a little injury like this that ends up where you can't swallow for some little period of time. Now we're talking some pretty serious distress, right? So back to my rule of ahimsa, that while I'm working to help and bring happiness and healing and welfare for my client, I want to really avoid doing things that will cause them a lasting distress or injury, all right? So when we come up from the center here, we come from the center around the bottom of the back of the cranium, and then we continue that crescent to the top of the ear. And that point, dead center over the top of the ear, keeps us in the right place. All right. Now the other thing that's kind of cool is as I come up, I'm going to turn her head in, because what I'm doing is I'm letting her head provide some weight on my fingers. Okay. Now you could do it without that. I mean, you could just go up here and just work in. But there are 2 different ways of doing that. Now I come up and back. Don't worry about the pressure. If I wanted pressure, I'd have her in the side lying position or the prone position. If I wanted strong pressure, I've got her in this position so I can cradle and be nurturing as stronger qualities than pressure. Okay? Now I'm going to do the other hand, work the other crescent. Okay? So I'm just going to knead in there with my fingertips, 5 points. And of course, you can't pinpoint the points because I'm working them with 3 fingers or 4 fingers. Right? So wherever those 5 points are, I'm going to get them. If I just do 5 different little positions, there's overlap, right? Because my hand's wider than 5 times the distance from the center to the ear. But it's my focus is what drives the energy to the points. And by focus, I mean visualizing the points, right? So I come up, I'm going to come right over the top of the ear and down. See, I'll just sit up comfortable. I'm just hanging, right? Just relaxing. I don't have to look down. I know that this kind of lumpy thing in my lap is my client's head, so there's no particular reason, and I can tell the back from the front because the front's got these bumpy parts, you know, like the nose, and squishy parts like the eye, so I don't have to look down to know what part of the head I'm on. And now I'm back to the center, right? I'm going to do that push-up one more time. So I'm doing that occipital